Hello, my name is Valeria Andrango and my topic is Hepatitis B. Hepatitis B is a virus that causes liver disease and inflammation of the liver. We can see in this video the structure of we can see the molecular structure of the hepatitis B virus with the HBV capsid and the lipids involved. Also, we can see the antigens of the HBV capsid. To diagnose this disease, we take a blood test which shows if you have it. A blood sample is taken using a needle inserted into a vein in your arm or hand. Getting a liver biopsy of chronic hepatitis B is suspected. The doctor uses a needle to take a small piece of the liver tissue. You will also have a test to measure the level of HBV in your blood. This test this lets your doctors know how your treatment is working.
Your doctor may use a variety of tests to check your liver and monitor the virus in your body. One test your doctor may use measures the amount of virus in your blood, also known as your viral load. This test is called the HBV DNA test. Another test, commonly referred to as ALT, looks for active liver inflammation. And finally, your doctor may take a sample of your liver tissue through a liver biopsy. This test helps determine if there is current liver damage or inflammation.
The disease are the acute hepatitis B is a short-term infection with the hepatitis B virus. Symptoms usually last several weeks, but they can last up to 6 months. The infection sometimes clears up because your body is able to fight off the infection and get rid of the virus. Most healthy adults and children older than 5 who have hepatitis B get better without treatment.
If you have a chronic hepatitis B infection, your liver contains a large amount of scar tissue called cirrhosis. When either the hepatitis A or B virus enters your liver, it invades your liver cells and makes copies of itself. With the virus. As a result, these liver cells become inflamed and then die.
The treatment for this disease are plenty bed rest, drink plenty of fluid, and eat healthy foods. The acute hepatitis B needs no treatment other than careful monitoring of liver and other body functions. The other disease is the chronic hepatitis B. Chronic hepatitis B is a long-lasting infection with the hepatitis B virus. Chronic hepatitis B occurs when the body can get rid of the hepatitis B virus. Children, especially infants, are more likely to get chronic hepatitis B, which usually has no symptoms until things like liver damage appear. Without treatment, chronic hepatitis B can cause liver cancer or severe liver damage that leads to liver failure.
If you have hepatitis B, your immune system will usually remove all the hepatitis B viruses from your body. In some people with chronic hepatitis B, particularly children, their immune cells are unable to remove all of the hepatitis B viruses.
The treatment is the patients with chronic hepatitis B may be treated with antiviral medications or a medication called pegyarfirine. This medication can decrease or remove hepatitis B from the blood and reduce the risk for cirrhosis and liver cancer. The cause of hepatitis B. People never get rid of the hepatitis B virus. This is called chronic hepatitis B. People with chronic hepatitis B may not have symptoms and not know they are infected. Over time, they may develop symptoms of liver damage and cirrhosis of the liver. Inflammations can cause organs to not work properly.
You have hepatitis B. The virus entered your body when you were exposed to the blood or other body fluids from a person infected with the virus. This could have happened from sharing a drug syringe with an infected person. Other ways you may have been exposed to the virus include having sex with someone infected by the virus, sharing personal hygiene items such as razors or toothbrushes used by an infected person, direct contact with the blood or body fluids of an infected person, or when when a mother passes it to her baby during birth.
The pros of hepatitis B is the hepatitis B vaccine or hepatitis immunoglobulin shot may help prevent infection if you receive it within 24 hours of contact with the virus. Early diagnosis and treatment can help prevent liver damage.
The virus itself is a tough customer and can survive for days on things like a razor, a countertop, or a toothbrush, and still infect.
So, if you think maybe someday you'd look good with pierced ears or a tattoo somewhere, you could catch Hep B if there's even the tiniest amount of infected blood on the equipment. But a simple immunization can protect you. Maybe you want to borrow a friend's nail clipper, toothbrush, or earrings. Same story. Vaccination will protect you. Sexual intercourse is another way Hep B gets around.
If you don't
The preventions for the hepatitis B virus are children and people at high risk for hepatitis B should get a hepatitis B vaccine. Babies should get first dose of hepatitis B vaccine at birth. Healthcare workers and those who live with someone who has hepatitis B should get a vaccine. Infants born that mothers who have acute hepatitis B or have had the infection in the past should get the special hepatitis B vaccine within 12 hours of birth. Measures that to avoid contact with blood and body fluids can help prevent the spread of hepatitis B from person to person. Thanks.